Hi, and welcome back to Conversations on Natural Birth. My name is Mia White, and I'm the author of the book Beautifully Born that you can see here. The subtitle is Empowering Women for Natural Birth. Birth doesn't have to be traumatic. This is Vienna in here, and she's about to be born in any time now, really. And she's my ninth birth. And I'm just passionate about empowering you as a woman and mother to be, to know that you have what it takes, not only to birth this beautiful creation in a natural way, but also to continue caring and nurturing this child in a natural way. And that's why in this video we're talking about nursing, which we've started to talk about before. But in this one, I just want to empower you also to know how to take care of your breast, which is like such an important part of your baby's nutrition and life outside of the womb. Nursing can be an adjustment for us as women. And in the beginning, because our nipples are getting used to the suction of the baby, they can get sore and we can experience some pain, and it's important to know what to do about that, because expectation, I found, is everything. If we expect something to be no issue and there's an issue, then we can experience disappointment or frustration, and that's not what we need as we are adjusting to a life with a new baby. So for the baby to latch onto the breast in a way that doesn't hurt us, we need to know what that looks like. And this video is just talking about this very briefly. You can read more about it in my book, but also take the opportunity, if you have any issues at all, to contact the La Leche League, because it's such a blessing. They will have some information you can read about nursing, but you can also ask questions. And at least as far as I know, in every country that I've lived in, there's La Leche League people, volunteers, that will even come to your home and allow you to learn with their help how the baby can latch properly. If the baby latches onto your breast properly, it doesn't only help you not to hurt, it also helps the baby not to swallow air. And we don't want our baby to be swallowing a lot of air, because then they can get like cramps in their stomach. And so we just want it to be smooth. So basically, a key to nursing a baby really well and latching on good is for the baby to be lying sideways on your stomach with their head in a position where they have to reach reach their little chin up and open their mouth wide to get a large part of your area around the nipple inside of their mouth, like a good healthy chunk of that inside of their mouth. And if the baby has latched on well, you will see it by their jaw moving back here. Like if their jaw is moving up and down, it means that it has a good latch. And also if it doesn't feel painful to you, it should feel good to you that the baby, has latched on well. If the baby got a poor latch, it got a too little of your nipple area inside of its mouth, then make sure not to pull the baby off, because as you pull the baby off, you can hurt yourself. You need to make sure that the suction is released before you remove the baby, and then the baby latches on again. And then as the baby gets on a good latch, that's when you allow it to stay and nurse as long as it wants to. Nursing on demand and as much as the baby wants to is a key to healthy milk production and healthy adjustment in general. We don't try to make our babies adjust to our schedule. It's absolutely the other way around. As we're getting used to life with a baby, it's about the demand of the baby, the needs of the baby, and every baby is different and has different needs, even for how much they want to stay on the breast. As the baby is not nursing, in the beginning, when your nipple is getting used to the nursing process, it's important that your breast is not always covered inside of bras or whatever. To let your breast air and breathe is important for the healing. If we get little crusts and wounds or cracks in the beginning, let's not be too disturbed by that, because there's a way to help it to heal quicker. We can use coconut oil. I have found there are different things you can buy at the pharmacy, but I have found the most natural way of just using extra virgin coconut oil and making sure that my nipples do not get crusty or dry, that they are always moist and that they are aired. And even the milk itself, the milk is like a miracle, potent miracle medication for anything really, but even for the nipple itself. So to push out a little bit of extra milk and allow it to sit on your nipple, that is also very healing. And just know that these issues with nursing, they eventually subside and they disappear, and nursing becomes the most natural thing. Even I would say to mothers who are concerned about the amount of milk that they're producing, and mothers who in the end feel like they have to supplement with formula, please let it be then supplementation only, and allow your baby to still bond with you by nursing for as much milk as you have. Nursing is not just for food for the baby, it's for comfort, and it's for bonding, and it's for hormones to be released in you, to return to your pre-pregnancy weight, to feel emotionally stable, and so many other things like that will help with postpartum depression and so on. So allow the time of your baby being on your breast as much as you can. Now, the last thing I want to mention in this video, and this is our next to last video in this series of conversations about natural birth, it's to allow yourself as a mother plenty of time to rest and adjust and bond with your baby. And I know that different countries have different laws and regulations as to how much time you get off of work or whatever. So what I will talk about is an ideal for giving yourself permission, if you can, as much as possible. I encourage this, to allow for 6 weeks. What happens, and what has happened to me many times after birth, is that because I feel strong in my body, the body will many times heal quickly and adjust quickly, is that I will do too much too soon. And one of the indications that we are doing too much too soon is that our emotions start to unravel. We are so intricately made, and we're so complex in our makeup. Everything goes together. And this is also how women end up being depressed, because we don't understand that the time of rest doesn't only have to do with how we feel physically, it affects our emotions. So what we find with women is that when they start doing too much too soon, they will actually revert even in their healing process, and they will start bleeding again. Like when the blood is supposed to have decreased or not be bright red anymore, we will find that women start to have bright red bleeding and an increase of bleeding even weeks after birth, because they are pushing themselves, expecting too much of themselves. And maybe it's the environment around you or the people around you that expect too much of you at this time. And it's important then to be empowered as a woman, to know that you are allowed to take care of yourself. You really are allowed to take care of yourself. So the 6 weeks, I feel, is like a sacred time. And I know that many people feel like it's a long time. It doesn't mean that you're in bed for 6 weeks. It means that like you don't exercise in the first 6 weeks. You tell your husband there is no sexual intimacy for those 6 weeks. Like your body belongs to your baby during that time. And there's gonna be, just so that everybody knows, I'm not going to be cooking or cleaning as much. I'm going to be taking my time. I'm not gonna be running errands. You know, this baby is not supposed to adjust to a previously busy lifestyle. It's a time of adjustment together with the baby, where the baby also is telling you what he or she needs. And we don't want stressed infants, and we don't want unraveled mothers. We want healthy adjustment time after birth. Anyway, I'll meet you again in the last video in this series, and I encourage you to go online and, of course, buy the book Beautifully Born by Mia White and educate yourself. Anyway, I'll see you one more time in the last video. Thank you.